Hey guys, my name's Chris. I'm just going to give a little word of this is just some tips that you can use after you have rotator cuff surgery. I'll tell you, I've had like 13 other orthopedic surgeries. I've been through a lot with broken bones, metal rods, broken back, screws, plates. Um, so going in this rotator cuff surgery. Um, I didn't really know what to expect. I didn't think it was going to be that big a deal. They're going to go in and sew my tendon up. So, number one is you're not going to be able to use your arm for like 6 weeks. I mean, at all. I found the easiest way to get my pants on was to, pull them up with my non surgical arm and then have my sling off and lay in the bed, you know, like sit down on the bed, lay back, and then, button my pants that way. That's one tip. No, I didn't always do it that way. So, I mean, you should follow whatever your surgeon says. I'm just trying to give you some tips that I used. Um, so, I did buy um, one item that helps you button your shirt or button your pants. This might be helpful to you. You can get it on Amazon. It was like $8. I'll show you a picture of it right here. It's this item right here. So this piece, sorry about that, but this piece, like you loop it, you push it through, grab the button, and then pull, and then this can pull your zipper. If you're having trouble with your zipper. I did find that getting dressed was one of the hardest things. And then also, I already had one of these. I would recommend getting one. I think it's great just to have for. I like to pick up my clothes with it. I mean, I'm pretty healthy and I don't have any problem picking up my clothes, but I just like using it. So I'll show you what it is. It's this right here. It's got a little hook right at the top. You can see that, and then it also it's got a handle. So I'm gonna just show you guys right there is what it looks like. So you can see it's got a handle right here. It's about 3 feet long. That was very useful to get things, grab things, with my non-surgical arm. Um, Other than that, like the only other thing I would recommend is if the doctor will give it to you, get a list of what you can and cannot do before you leave the hospital. Maybe even read it a couple weeks ahead of time. I know that some of the doctors they don't know what they're gonna do when they get in there. They might see more damage than like the MRI showed, which was my case. They wound up doing like 5 things, and they were originally going to do 2. Um, so these things helped me a lot. Overall, it was, fortunately, I slept good. I hear a lot of people don't sleep really good. I don't know why, but I slept really good. One tip would be for sleeping, if you're having a hard time sleeping, is to go get in a dry sauna. If you don't have a gym membership, I mean, I believe a gym is like an investment in yourself. So I don't really, some people say, oh, they don't want to pay for a gym, but I see that as time that I'm investing in myself, to get into a gym, to do, I mean, obviously, you're not going to be doing weights after rotator cuff surgery, but, to use a dry sauna. There have been times where I've gotten in a dry sauna and done that and really didn't get like that many hours of sleep, but the sleep I did get was really good. So that would be another tip that I would recommend. I know my surgeon told me I was not supposed to get underwater, like submerged, for a month. So, whatever your surgeon says, you should follow what they say. I'm just telling you some of my tips, but these 2 items, can be helpful on your recovery, walking, keeping your blood pumping. Because the tendon, if, especially, most likely you had your tendon sewed together. Tendons don't have a lot of blood supply. That's why they take so long to heal. So the more you get the blood pumping, walking, moving around. Right now I'm 9 weeks out, and I've gotten a lot of range of motion back. It's still pretty stiff though. Like, if I try to really straighten it out, like above my head. My therapist's been good each week. I'm starting to really notice some big difference though. Um, I'm still not supposed to be picking anything up heavy. Um, I've really been trying to be careful because I definitely don't want to tear. I was actually in a pretty good amount of pain. I mean, I didn't just sign up for rotator cuff surgery. I mean, it was bothering me at night, going to sleep, doing weights, et cetera, et cetera. So, guys, I just want to share these tips. Be encouraged. You'll get through it. And, if I would have known, probably for me, it was just like if I would have had that printout before my surgery, it would have helped me prepare a little better. I mean, they explained it all to me, and it's not like it wasn't available, but, I'm just trying to help you guys prepare. So, anyways, good luck with your surgery, and just follow what they say. Bye.